big challenge to stimulate you to think. So the main topic we are going to speak today is about building a digital ecosystem for resilient, healthy, and independent EU citizens. And it's not surprising that in our rapidly changing world, the need for a robust digital infrastructures. What? Sorry. It's not working like I. See?
It's the weight of the.
No, it's not. Sorry. That's because
of the story.
Okay, I will just tell you. Okay. So, in our rapidly changing world, the need for a robust digital infrastructure to support the well-being and interdependence of EU citizens has never been more critical. This need was further highlighted by the COVID-19 pandemic, which exposed the urgency of resilience, technology system, and seamless connectivity between systems, professionals, and other stakeholders to provide an efficient response to citizens. During pandemic, we actually highlighted this importance of having a well-integrated digital ecosystem capable to supporting healthcare, social services, and daily living, particularly in time of crisis. So the purpose of this session is first to explore the necessity, potential, and functionality of building a digital ecosystem to support the well-being and interdependence of the EU citizen. And when we speak about the EU citizens, we want to think that the citizens are in the core, in the center of what we want to provide them in this ecosystem. To examine the risks and the challenges involved in creating and maintaining this ecosystem, as well as future expectation and development, and to better understand how a well-integrated digital infrastructure can foster resilience, health, and independence among EU citizens. So if we look in a more broader way, so we want to think that the patient or the citizen are in the core of what we want to provide them. But around them, there's a lot of actors. We call them the stakeholders. So they can be the pharmacy industry, research institution, medical staff, from a variety of fields. The technology companies, of course, they are providing the services, government and agencies, and the community itself. All of them are creating all this of ecosystem, and the main challenge is to better understand how this co-creation, how this integration, how this interoperability that we heard a lot during this day could be happening in order to have a more resilient society, specifically in time of crisis. So we have today 6 distinguished experts from different fields that will provide or share with us some highlights from their perspective, technological, government, and others, to these challenges that we are facing. We will start with Ms. Katia Ferrier from Cesaram, please, and we will continue after that the others. Please, Katia.
Thank you. Thank you, and good afternoon to you all. First of all, and as I'm the only Madeirans in this distinct panel, let me welcome you once again to Madeira. You will see the 2 most beautiful islands you ever see in the world. It's really an honor for us to receive you in our home. My name is Katia. I'm here representing the public health system of Autonomous Region of Madeira, the so-called Cesaram. and now we'll explain how we are building our digital ecosystem for resilient, healthy, and independent citizens here at Madeira. As you might heard in the last days, or even also today in the morning, the autonomous region of Madeira is a healthy, safe, sustainable, innovative region to visit or to live in. And for that reason, a strategy has been pursued to develop its public health systems with innovation and a citizen-centric approach. I personally consider it to be one of a kind. Let me show you. Who are we? But it's not appearing here. I will keep speaking. We are the only the public healthcare provider. Who are we? We are one of the five organizations that are managed by Dr. Pedro Ramos, the Regional Secretariat of Health and Civil Protection. Along with us, we have the Civil Protection that is very important for us, and you will understand why. And we are the only organization that has the power, or that is in contact with the patient, that is an actual healthcare provider. We are organized around 3 hospitals and 47 primary healthcare units, and we have 2 support units, 1 screening unit for several diseases and cancer diseases. And we also have the clinical simulation center that is very important for training our professionals. So this system serves our inhabitants and 1 million tourists that annually visit us. We have now more than 6,000 healthcare professionals, and for the work done, essentially after the pandemic, in June 2022, CESAREM was awarded as an honorary member of the Order of Merit by the President of the Portuguese Republic. This is our dispersion along the islands. You will see the 3 hospitals here near Funchal, and then around the island you will see the primary healthcare units. It's important to highlight that some units you will see with a red circle and a red cross have also emergency departments. This allows people not to need to come to the hospital to get a patient care. So how do we started our digital ecosystem? It started around 30 years ago when someone envisioned to create this unique healthcare electronic health information system that it's now called Atrium. So we are also a software house because this system is developed daily for our IT team. Atrium is now the core system of CESAREM. We have lots of application and external systems implemented, mobile apps and portals. And one thing that I would like to highlight is this RAM-HUM module that allow, for example, I, Katia, get injured in the street and I call 911, and then the civil protection agents that come to me to help me, when they arrive next to me, they insert in this tablet all the information about me, what are my vital signs, what happened, and when I get to the hospital, the clinical staff already knows what happens to me. In Atrium, everyone has a unique ID and a unique electronic record. So Katia, me, if I go to Hospital Nelly Mendonça or if I go to the primary healthcare unit in Porto Santo, the clinical staff will know exactly the same thing about me. Again, for this system, 2 years ago we got to be awarded with Interoperability Award for the system because it actually allows interoperability with lots of external systems. Then we had Atrium. What did we decide to do next? We are these islands. We have a proper system. And so we decided nearly 1.5 years ago to create this unique electronic health record, so-called Processo Clínico Único. It's actually an information sharing model between our atrium and the external health providers, private providers, and it allows doctors to have access and to register the information in one unique system. Since 1 of June 2023, we have this implemented with some pediatric clinics, and now and we are seeing that it's very, very good because it allows us to reduce costs, because people don't need to go to make another exam when they go to the private provider, and it has a lot of gains for users, mainly for the doctors. Again, last year we were awarded for this idea that we are implementing here for the Portuguese Association for Integrated Care. Next, we are also involved in this collaborative initiative that allow us to be experimenting these projects to actually learn the best practices about sharing data, about using medical devices to get more data, and we are working within these projects. Let me say, for example, in Smart for Health last year, we were one of the organizations that were responsible for testing the solution, and for example, Katia, I now have some of my clinical records that are on Atrium. It's on Smart for Health. And with Smart for Health, I can go to, for example, New Zealand and ask for a doctor opinions there and leave, with me, I have the information, medical information to show to the doctor. Last but not least, we are here at Madeira building another hospital. You might have seen it. It's planning to be finished in 2027, 2028. And we want it to be a Kiwi hospital with more knowledge, more intelligence, more wiser, and with more interoperability. We want to include, as a practice, telemedicine, mobile health apps, wearable devices, a unique electronic health record, and artificial intelligence. And by gathering data from patients, lifestyles, medical stories, we want to develop a more personalized medicine here at Madeira. As Peter Drucker said, the best way to predict the future is to create it. We are trying to do that. Thank you.
Thank you, Katia, for sharing these insights with us. I must say from a personal note that it was my honor to be part of this part of the project that you mentioned. And for that, I had this honor to see how this magnificent island is like a living lab that actually create all this ecosystem as a living system, and the connection between community health services and what we are actually seeing here actually happening. So I would like to continue with Mr. Germán Gutiérrez from Iberia that will share with us also the insight, please.
Okay, thank you very much for the invitation. So in this very short time, I would like to do some reflections about ecosystem, not going in depth in what it does mean, an ecosystem, but at least to put the focus on a couple of reflections that I think is important, at least from our perspective. Just to start with the definition of ecosystem. Ecosystem is an interconnected, diverse components that tend to sustain themselves in a medium that determines conditions to fulfill. And that is important because interconnection is an attribute that is key for an ecosystem, but also sustainability. You don't have an ecosystem if the structure is not sustainable. Of course, in digital health ecosystem, you do it for a purpose and you put the citizen at the center, and you have an enlarged digital ecosystem because it is not only about tools, it's also about a lot of stakeholders that participate in the building and the sustainability of such ecosystem. So to the right, I think this image is very self-explanatory because we go from a collection of tools or stakeholders into something that is seamless, integrated. So what is our medium? Basically, the governance and regulatory bodies, so we need to meet some compliance requisites, security, ethical standards, and we are in a medium also with a lot of collaboration, and you need to have those drivers for collaboration, so to set partnerships, to have shared goals, and to have open innovation. But it is nothing if we do not reach sustainability. And I want just to put the focus on one of the aspects of sustainability, because we are in a hype. The digital health market is in the hype. But if I make the question about how many of those companies and those startups are going to be alive in the next year, we have the shocking number of 98% of those startups are zombies. They are not dead and they are not alive. They are just in between, and they maintain for years in this situation, but the reality is that they are going to finally die. And why they die? Because of many things, because they interfere in the reality with the physician workflow, they don't satisfy the needs of multiple stakeholders, they rely too much on changing human behavior, they are not very different from one to other, they underestimate the length of the sales cycle and just to the reality to have impact. So at the end of the day, it is very hard for all these companies to really be part of a sustainable ecosystem. And that is my first message. We need to be careful, because if we select animals that they cannot alive by themselves in that medium, probably they are not going to be part, or we are not going to have a very successful ecosystem. So first message, be careful with the selection you make with the animals or the life that is going to be part of that ecosystem. The second reflection is about a connection. Ecosystem is about interconnection. If you don't have interconnected animals, then you don't have an ecosystem. So getting out of a system where nothing communicates and data is not very useful is a condition for an ecosystem. And we need to really work on this area. It's not about to be interoperability ready. It's about doing real integration of functionalities and being able to orchestrate workflows inside the healthcare infrastructure. So today in a hospital, in a typical hospital, you have a lot of applications, a lot of silos. They are not interconnected. The information is fragmented. And what we want, just to have an ecosystem, is something in which everything is connected, or most of the things are connected, that you can interpret the information, and not only interpret the information in order to drive decisions, but also to orchestrate the workflow inside the organization. You need the output of some of the applications to be the input for other applications. And we are miles away to get this fulfilled. So the challenge for the future is coming from this situation in which you have many hospitals, many apps out there, everything not interconnected, or just connected with one hospital, but you have to make the rework of interconnection and integration with other hospitals, to a situation in which you can have seamless integrated tools, through a way that is not only for a hospital, but for a network of hospitals, that you can more easily take advantage of the work made by others in order to integrate your animal into the ecosystem. And that's why in Medtronic, I think we consider very important, extremely important, just to work in this piece, in just facilitating to hospitals and to providers outside of the hospital this interconnectivity through microservices that could really operate in creating this data exchange and to be able to act based on the data that is generated by the ecosystem. And that's all from my side. Just to thank you the participation and the reflection that sustainability is a key attribute of an ecosystem, and you cannot reach that sustainability without interconnection with the appropriate animals for the ecosystem. Thank you.
Thank you very much, Juan. So we just highlight the two main challenges that we are actually facing. First is the sustainability of the company services that we are actually getting into this ecosystem, but the second one is actually the interconnection or interprobability that we all actually are facing, and how is this going to be happening. I would like to invite our third speakers, Professor Georg from the University of Vienna. Please.
Thank you.
Okay.
Okay, yeah, thank you very much. Thanks all for the invitation and for giving me the opportunity to continue. And I decided, even though I'm from the university, I'm a researcher, I'm a teacher, I decided to contribute to this discussion not from a scientific perspective, but actually from a personal patient, or as Tal corrected me, it should actually be the citizen's perspective. I already reached an age where I need more medical attention than when I was younger. I take a medication, the classical ones for a 60-year-old man. And I had a couple of minor emergencies in the past that needed some attention. And at the same time, I'm a computer scientist. I know what theoretically, technically would be possible. And I'm stunned how little is possible. So here's the ideal that I would like to imagine. I mean, just in any other area like this, these are the apps I contacted to come here. Travel agencies, flight bookings and all that, and I have all my information is there. I just click a button, they have all my passenger details and everything. And when I came here, I wanted to take the cable car up to Monte. Of course, I didn't have to stand in line, I could get the ticket online. So why shouldn't that be possible also in medicine, in healthcare, that I have all my information centrally? I know that's the electronic health record, the idea, but it simply doesn't exist that way. And I have all the basic information stored that when I need medical attention, I should have an app that points me to the nearest and most earliest available doctor. And if I need reminders, it should be automatically all that. And even though I hear Austria has been, and this is of course a perspective from Austria now, if I hear that Madeira perhaps is much more advanced, so I might think about moving here. But in Austria, I hear that we have been somewhat a pioneer in electronic health records in Europe, but the reality is terrible. I mean, my ELGA, as we call it, is simply empty. I had been at an ambulance a couple of times. They had done tests and came to diagnostic conclusions. Nothing is in there because I hear only stationary hospitals at the moment are automatically transferred. I don't get any easy way of knowing when to follow up to get lab values. I know that some of my lab values are a little critical. I should watch them every year. I have to think about it myself. So blah blah blah. It's really, the reality is really way behind what I think ideally could could be possible, like digitalization, for instance. That's also very funny. I mean, many hospitals think digitalization means you scan a medical report. Bring your report, please, with USB. No, print it, and then they take it and put it in a scanner. So this is the way of digitalization at the moment in many clinics. There are some local solutions. They work very well. Like all my lab values, I always go to the same lab. I can retrieve them, but there should be a universal one, or there should be a connection one. So what do you think? What are the challenges? What hurdles need to be overcome? I mean, I hear in Austria especially, one of the hurdles is that physicians are afraid to be confronted with too much data. They don't want that. They want to keep the EHR as small as possible because they're afraid they have increased liability. So we have to allay them of those fears. We have to implement procedures that they don't have increased liability through a lot of data. On the other hand, we also have to overcome the overly sensitive view on data protection among the citizens and among the health institutions. I mean, of course, data protection is important, but we should, for good reasons, be able to share the data, store it centrally, that everybody... I don't know how many times I filled out a paper form with my allergies and which medications I take. Why can't that be in one place and I just point to it and it's retrieved from there? I'm not so afraid of my data getting in wrong hands, so we should care about security, but we should lay those fears. So at the same time, we should get to near perfect data security and, as it was mentioned also before, interoperability. So as a computer scientist, I'm kind of ashamed to see how difficult it sometimes is to get data from one system into the other. Every industry has their own proprietary data format, so that certainly needs to be overcome as a challenge. So thank you.
Okay, I think you raised a really big vision and challenge. So the main thing for us is how we can connect all this data as we, as a citizens or patient, will have our own electronic record and we can control it, for example, and go wherever we want with that. This is mine, this is ours. Can you please take a look of it? So this is not yet going to happen. I introduce you to Andrea from Roche, that will highlight your insights into these challenges.
Yes.
Hello, good afternoon. So, some perspective from the industry. Accelerating access to innovation through open ecosystems. Now that's our way of addressing the challenge that was given to us. So how to build a digital ecosystem for resilient, healthy, and independent citizens. And what I read in this sentence is really having the patient in the center. So how do we move from the current status to a patient-centered care? So today we know, I don't need to talk a lot about this, but traditionally patients have been treated by medical areas, and therefore information also stored and organized around these specialties. So it's siloed, and what we really need to do is to break those silos in order to create longitudinal databases and collaboration of different actors, different companies in the ecosystem, so we can really leverage collaboration in the digital space and enable insights that really bring value to our patients. Some of you probably know about this data, but I would like to highlight this. There was never so much information about health than today. Actually, health information is doubling every 73 days. In the case of diagnostics, which is the industry where we come, and maybe some of you don't know, 70% of medical decisions are based or influenced by a diagnostic test. And we, Roche alone, we produce more than 27 billion tests that are used for our patients every day. So there's a vast amount of information, yet, as we can see, 97% of this data is still unused. So at Roche, we have three main principles to address this challenge. The first is having open ecosystems. So this is key. Only with digital ecosystems, with systems and infrastructure that allows us to collaborate with other companies, will unlock this opportunity. At Roche, many of our digital solutions are now open to other parties, and I'll give you one or two examples afterwards. The second principle is health science, of course. So bringing science to technology. And the last one, of course, patient centricity. All the insights, all the data needs to be used, having the patient in the center. And why is this so important for Roche? Because our North Star is really revolutionizing personalized healthcare. And personalized healthcare means better care, which is what we wanted to talk in this panel, and for sure, better care at a lower cost. So this is also a changing of paradigm, because as famous doctor said, so we need to treat the patient, not the disease. So meaning that the old one-size-fits-all approach does not fit anymore this personalized healthcare and the centered patient system. And for that, we really need the collaboration of science, data, and technology. So this is key to allow personalized healthcare come into a reality. Being a little bit more tangible, Roche is a diagnostic company and also a pharma company. So we try to be present in all of the patient journey and bring solutions or having open ecosystems that bring solutions to cover all the needs throughout the patient journey. Okay, let me say in short some of the areas where we are working. The first one is digital infrastructure. So I think this was more than explained that a solid digital infrastructure that allows communication, that allows sharing data is critical to leverage all the other potential tools to generate insights from data. Then lab insights. So we have big lab chains, for instance in Funchal, a huge lab chain that processes thousands of tests. With data from the hospital and from the lab, we can generate insights, for instance using also artificial intelligence to improve the workflows, to prevent needs in terms of inventory, and therefore doing a lot for savings. And we do this not alone. For instance, when we look at the logistics of a sample that comes from a center, an healthcare center somewhere in the island to Funchal, we need to partner with a company that is specialized in logistics and has a digital solutions to make sure that that sample is coming to the hospital and we know that it was brought in the perfect conditions. In clinical insights and patient insights is where we look to data and try to generate insights that can improve the way patients are managed. Let me give you just two quick examples of how do we do this in practice. So how we break down the silos, for instance, in point of care. Cobas Pulse is one of our instruments, and basically you could say that it's a glucometer, but in fact it's much more than that. So it's a device that uses Android systems and has a couple of sensors that allows a lot of possibilities. And we work mainly with third parties that produce apps to join this ecosystem. For instance, a party that allows, with the camera from the device, to look at our wounds and with artificial intelligence provide detail and recommendations for its care. Or place it in the chest of a patient and have indications of potential atrial fibrillation. And that's just two examples, and this is, of course, bringing the patient to the center. So this device can go anywhere, even at the patient's home, and be used to monitor the patient in a different way. The second example is another platform, another open platform where different third parties can join. It's what we call Navify Algorithm Suite. It's basically a one-stop shop. It's a library of high-value medical algorithms that can be produced by Roche or for other companies that want to join this ecosystem, and then they are at the disposal of hospitals and labs. An example how this works in practice. We have call and flag. So call and flag is a machine learning algorithm that works mainly with the results of a complete blood count, so an mammogram, a routine exam, and combining that with age and sex, and of course with data from other patients, it is capable of giving a risk score for developing colorectal cancer. And this is a reality. Actually, we are already implementing this in Portugal. So, ecosystems, again, this is not a Roche tool. This was produced by a third party placed, in this case, in Israel. Just to finish, so as I mentioned, we are leaders in diagnostics and pharma, and we want also in digital to be present along the patient journey, from prevention to monitoring, because as we usually say, we want to do now what patients need next, and also in digital, that's what we need to do.
Thank you. I think that when we think about the ecosystem, and you see, we already mentioned the importance of the citizen and the patient in the center. I also would like to add another challenge, and after that we'll discuss how we can engage them. How we can engage the citizen or the patient to be responsible for their health, to be there, to be, engaged to all services that we are actually offering them. And this is we know that from other areas, this is one of the big challenges to create this engagement and responsibilities. I would like to continue now with Professor Enrico Martinez. So maybe you can combine between academia and the other law and other aspects that we are missing also here.
Thank you. Thank you very much. Thanks for the invitation to participate in this panel, and it's a pleasure always to be back in Madeira, sharing some ideas, some thoughts. Let me just find a way to navigate through this. I'm thinking about this topic of well-being through personalized health data spaces, and the first thing I want to wake you up, in case you need that, is that we have been always talking about well-being. But I also want to reach to the last slide already, because we were very short in time and we've been told we cannot go off time. The question really is, can people be well when they are not well? So sometimes people say, okay, it's about health and it's about well-being. Actually, health data is very important for you to be well, even though you have a medical condition. Right? And earlier today we were doing a workshop and we needed patients in the audience, and we found a lot of patients very easily. So who here is a patient? Can you raise your hands? Can you raise your hands? Can you make sure you raise your hands, because I'm pretty sure most of you are patients of some sort. Anyway, so this topic is for all of us. The idea is focus on health data integration through this concept of personal health data spaces, which is a concept that we've started writing, and with other colleagues, some also in this conference like Anne Moon, I want to share that thought. As a concept to make individuals capable of using their data for managing their conditions when they have them. And of course, more importantly, prevent and avoid having disease, promoting well-being and being well despite of disease. So if you only have one slide from me, this is the slide, so please take a picture. And this would allow us to answer at least 6 of the questions that we were sent by email that we should be able to address. So from your point of view, what are the major challenges in implementing digital ecosystems for resilient? We do not control our health data, we as people. Maybe Cesaram controls our data if we are a Madeira citizen, but even the Madeira citizen does not control his data, right? So that's the next level. What are the potential risks and threats in building and maintaining such ecosystems? I have to tell you, the biggest risk, we don't have it. So stop coming up with all these stupid risks of cybersecurity and personalized bridges and privacy. The big risk is because we don't have this personal health data space, we suffer. We suffer drug-to-drug interactions. We suffer from allergies that we shouldn't have suffered from. This is a much bigger risk than any stupid cyber attack risk to data that is not even digital. So I always like to stress this out. What are the key functionalities that the digital health ecosystem should provide to users? The capacity of users to delete their data. Why am I saying this? And this is not even something that most legal people agree. It's because when you give people the capacity to delete their data, you are trusting the literacy you gave them. You are really putting an emphasis on the education you gave them. And you stop the stupid argument, oh, we cannot allow patients to delete their medical history because they might delete something that is important for them. How silly can that be? Anyone with a reasonable IQ and good health literacy and digital literacy would never delete their own clinical data because they know, hence we would have done a good job providing digital/health literacy and quotation, they would never delete it because they know it would be harmful for them. Would you delete your bank account numbers? Would you go online and delete your euros in your accounts? I don't think anyone would delete your numbers if you could delete them, right? Could you delete them? Maybe you should be able to delete it, but you can donate your money. You can go to your bank account now, try this. Go to your bank account and use my bank account number, okay? And just transfer all your money there. You can do this, you see? You own not just your data about your bank, you own your money. You can transfer your money to my account. Now, if I ask you, can you transfer your latest HIV exam to my mobile phone? Can you press an X-Share button? X-Share is a project that will be featured in Madeira next year in February. Maria allowed me to make this announcement. There will be a general meeting of X-Share on the 26th, 27th, and 28th of February. There will be some public events. And X-Share is, between other things, a project about sharing data using the electronic European exchange format and having a button on your phones, on your apps, that allow you to press a button like you do now with your pictures, and you share the picture with someone near to you using Dropbox or Bluetooth or Wi-Fi. I gave you a simple example, but I always like to give a very pragmatic example. You are in a disco in Madeira, and you want to have unsafe sex with someone, and you want to know his HIV status. So you say, you know, share me your latest HIV result from the clinic. Don't tell me you're negative, I want to see it. And actually, I want the real PDF, the real document with an electronic signature from your hospital or from your lab result. And he goes and says, of course, I'll press the X share button and you get it on your phone. Oh, okay, you're HIV negative. We can do it without condom. Wrong answer. You still should do it with a condom because there's other diseases in town, okay? I'm just giving a very pragmatic example of what for me is owning health data, is governing as I wish. Now, I gave you different examples that you would criticize. They all come down to literacy. So final conclusion, I think I have like, what, 3 minutes? You're using my watch, my phone to control the time. How many time do I have? 3 minutes, okay. I have time. So let's integrate data on the system. So we need a lot of hard work from engineers and others. Please continue to do the hard work of integrating the technology. For example, we're trying really hard at fire people talk to the open EHR people and they agree to talk to each other, because the biggest problem of building ecosystems right now is that sometimes the standards development organizations, they don't integrate. So then we, the usual people, cannot integrate with their standards because their standards don't integrate with each other. We as patients should be integrators of our own health data. And then, of course, we should integrate around processes of care. Just sharing my vision in terms of ecosystems, because different people share different models. I believe in what I call digital health systems. And digital health systems assume the core driver of care is the person and uses automated algorithms to make decisions, and only rarely, if needed, goes to telehealth appointments and telehealth services, and if really needed, goes physically to a hospital or a primary care center. We need to invert the order. It's not like you have a teleconsultation in case you like it. No, it's the opposite. You have a face-to-face appointment if you really need a face-to-face. You'd only go and be admitted in a hospital if there's no other way to treat you except to put you in a bed. Otherwise, you sleep home, and that should be where you sleep. This is our problem, health data. As a clinician, I've produced a lot of this. As a patient, I also produce a lot of that. And you see it's unstructured, it's structured, and the European exchange format doesn't help because we have written in the European electronic health data space that it is about structured and unstructured data, which makes it even more complicated, so we will have to integrate all sorts of data. Just before me, Roche was presenting that people are integrating data from devices. I always talk about this digital patient as the integrator. Who here in the room has a smartwatch or a bracelet that is collecting data about their health? Arms up. See? Many people are already digital patients or digital citizens. Now, are we getting this data into our health systems? Is Madeira's system already collecting the data from the Madeira smartwatches? Okay? And then finally, as I said to you, thanks to Anne and Giovanna and Catherine Kornacki, which I know she's following us on the stream, because I know she was checking if I was going to talk about XShare or not. So I did, Catherine. I hope you're hearing. Anyway, I really like this paper. I invite you to read it. You can access it online. It's open. And this is just my final minute. The first base is access and accumulation of personal health data. This is the first thing a country needs to offer to its citizens. The capacity to have my data in one account that I control. It's not that the country has it for the doctors and for the patients, for the nurses and whatnot. That's good, but that's not the end of the story. That's the start of the story. The second level of the pyramid is I, as a person, can curate, edit, add, delete data about myself. And in order to give people this capacity, we need to educate them. So this is a very important level. And then control. For example, with the X Share button, I can share my data. I get a request from a researcher. I know you are a diabetic because of your patient summary has ICD-10 for diabetes type 2. Are you okay to join my clinical trial? And I say yes. Are you willing to share all your data from the last 2 years? Yes, except the times I went to the emergency room with a hangover. I don't want you to know about that. And then visualizing and analyzing my data, and then living with my health conditions and using data to navigate through the difficulties in life. Example, very simple example I always give. If I have an allergy and there are streets in a certain town that have a high density of pollen, I want my Google map to have a filter, an allergy filter, based on my patient summary that tells me to avoid these 3 streets and change my route so that I'm not exposed to pollen so much. So that's what we are contributing to do in Expand the Age. If you want to know more about Expand the Age, you have 2 options. Go to the QR or go to the next session on Laguna 3, I think is the session. Thank you very much.
Okay, thank you, Enrico, to share with us your insights and your thought about risk or no risk when you're having, sharing your data. So this is a big debate, actually, that who owns the data and who can it's not really a question even, but we have the same dilemma when we come not only in health sector, also when we come to the academia, for example. Imagine your students come to you and ask you, please, can you delete my data from the records, all the grades, everything that actually was there, so how I can evaluate you? How can I have something? So it's the same, who owns the data and who's supposed to be around. So we are going to continue with one from Philip, and probably you will share us your thoughts from the technology point of view.
Perfect, I try.
Thank you.
Thank you. Well, first of all, thank you so much for having this opportunity. Probably you will see that some of the concepts are very similar, but it is good because this means that industry, research, academy, and the services are totally aligned. And my proposal is try to, through enablers and trends, try to explain our vision about the future of a digital hospital, or the future of the hospitals that for sure has to be digital. Because there are 4 trends that are shaping our future, or the future of the health technology. First is global resources constraints, that we all know about this. The aging populations and the rise of chronic illnesses, increasing consumes and patient engagements. Before this presentation, someone asked about how we engage the patients. I think most of us, we are patients, and we want to have more data, and having even our radiology images in our app or in our mobile, and digitalization, right? That itself is also a trend. Don't forget also the sustainability is something that we repeat many times, because you probably know that the healthcare systems is impacting as one of the most powerful, well, indeed, if the healthcare systems, including hospitals, are a country, we are the 5th or the 5th country more polluted in the world. Okay, that it means a huge number, and it is for that the system has to be the digital system has to be sustainable also in a matter of environmental. I talk about the sustainability in the environmental because being digital is generating more data, right? And we are increasing and we are capturing more data. It is for that a point that I think we have to put on the table nowadays is what is the real data that we have to capture and how we capture, right? To try to reduce the impact, just being a smart archiving of the data. Because we all know, we all are aligned that the future has to be personalized, because we have to deliver digital health solutions tailored to the individual. It has to be connected to healthcare delivery anytime, anywhere, and for sure integrated to give to professionals, to the clinicians, these 360 degrees or these concepts, as also mentioned, the digital twin concepts, to take the right decision with the right data. And what are the 4 enabling areas to do a digital transformation? For us, is for sure the people and experience has to be the patient-centric, as we mentioned many times today. The data and technology management, the governance and trust, that we see that in Madeira they are in a very good positions, and for sure the partnerships and the new business models. Related to the people experience, for us is trying or giving innovations, thinking that this design has to be human-centered, addressing the unmet needs for the patients, the consumers, the professionals, the patients, and for sure this experience has to be totally intuitive, right? And this experience or this vision for the people has to be adding the value of remote training, of remote collaboration, the telehealth, just trying to avoid even travels, as we already mentioned. And this data and technology has to be opened to connect devices, as we mentioned, the smartwatches, but also the new technology or the new generation of patches, that it's only one patch to have monitoring the people during 14 days or even more. And all this information has to be connected to the health services. The digital solutions has to be, for sure, designed for the future, for the real near future, the cloud-based. Because it is true that in different countries there are some different opinions about when the cloud-based and how private or public has to come, but for sure we all know in the same page that cloud-based is the very near future. And also turning all this data to really create insights for the general manager, insights for people that are managing the hospital, but also insights for creating better decisions for our clinicians and professionals. Related to the governance, we have some principles about the data. For sure, has to be security, has to be privacy, has to impact in the benefit of the customers again. And about AI, we have some principles. First, talking about the robustness. This morning we're talking about the different levels of robustness or risk of the AI and algorithms. Has to be for now human oversight, impacting in the health and well-being again. For sure, try to be inclusive and in the same way that we have to avoid bias and discriminations with the data. You know how the algorithms are training, and if we have a very limited database, we can get involved in this. And as one, the transparency. Relating to creating partnerships and why we should create partnerships is just to try to innovate together. We are the providers, and we really need we really want to know your needs, to invest for the needs today, but also for the needs that we will have in tomorrow. The open platform concept, for sure. We, as Philips, we cannot provide every single system in the hospital, and it is for that our vision is to be open and to be connected with the different systems being in home, even in-house systems, to have all information integrated. And this concept of trying to deliver projects or to deliver programs or initiatives with value-based care, trying to connect the clinicians, the decision makers, the providers to promote and to get better outcomes. And how we see this, how we can get the aim of better outcomes? Well, we can say with help, right? Because from Philips, we try to be from the beginning in the projects, to try to plan and design, help to the customer to understand what really needs, help in the organization, in the implementation. We will not trying to deliver boxes or just a black box that has not been integrated or has not been correctly integrated with the correct environment in the customers. And the continuous improvement, monitorize and optimize. I think the people that are here today has enough experience that probably the day one of an integration or a delivery of the software, it will not be totally integrated or just in the high level of perfect level. It is for that we have to continue to integrate and to integrate again and to see how we can do more. And last concept is the evolutive services, and it's because it is very good when you acquire a system and you have this integration done, and finally, you are just thinking in the next step. But the idea is to try to get maintenance services very focused in the evolutions, trying to have the technology always in the current versions or in the last version. And this is for that, and with these enablers, I think the next decade promises exciting developments that will continue to transform healthcare delivery. I'm totally sure about this, and just looking ahead and trying to anticipate to our challenges to have a collaboration with the public sector, with the private sector, to try collaboration and to get a successful future. And that's all for me. Thank you so much. Muito obrigado.
Okay, thank you. Okay, I think we are over our time, but if there are quick questions from the audience, so please, this is the time. Someone would like to raise something? So if not, I would like first to thank all the experts, and I think we have a big challenge ahead of us. If we have to build, create, maintain ecosystem that will be resilience for our next generation, each one in his own, fields, but together, I believe we can do can do it. So thank you.